The intern pharmacist oral examination will have three parts. Okay, so we can say that as part A, there is nothing but primary healthcare. Part B is legal and ethical aspects, and part C is problem identification and the communication skills. Hello guys. In case if you are preparing for the Australian pharmacist intern examinations, that is for intern written as well as the intern pharmacist oral examination, okay, then you must know about the intern examination pattern. So what are the things that they ask mainly in the oral examination? Okay, so the intern pharmacist oral examination will have three parts. Okay, so we can say that as part A, there is nothing but primary healthcare. Part B is legal and ethical aspects, and part C is problem identification and the communication skills. So among these three parts, part A is completely closed book examination, where you are not allowed to open any of the resources. Okay? So without opening the resources, you have to give the answer. Okay? So it is just like a scenario where a patient will come to your pharmacy and they will say that they have some issue, and you have to identify what exactly the problem that the patient has. And also you have to keep in consideration about other factors. If she is a female, if she is pregnant, okay, or if the patient has any renal impairment, okay, and any other gastric problems and so on, you have to keep in consideration about all those factors. Then you have to recommend an appropriate treatment. Okay? That is a part A where books are not allowed. You are not allowed to open any of the resources. And part B is legal and ethical aspect. Even here, the resources are not allowed. So there will be a scenario where you have to speak about the legal and ethical parts. Even resources are not allowed for this section. And part C is problem identification and communication skills, where the resources are allowed. So they will give you a scenario, they will come up with a prescription. You have to identify what is the main problem with the prescription, or you have to identify what is the main problem with the other comorbid condition that the patient has. Okay. So these are the ones that you have to identify, and then you have to call the doctor, you have to talk to the doctor and rectify the issue. Okay. So here the books are allowed, which means the references are allowed. You can open any reference, it doesn't matter. Okay. But again, it will be a challenging. So the important take home point is either if you take the part A or the part C, the main thing that you need to know is you must be perfect with history taking template. If you are good at history taking, if your history taking skills are good, then easily you can pass this examination. Okay? So for more updates about the Australian intern pharmacist written and oral examination, so please subscribe to our YouTube channel, and please share this video among your friends. Okay? And we'll keep on giving more updates about it. Okay? Thank you so much.